Number 12, slowing the progression of type 1 diabetes.
A new drug approved earlier this year can delay the onset of type 1 diabetes in children and young adults at high risk for the disease. Type 1 diabetes is a chronic illness that results when the body's own immune system attacks the insulin-producing cells in the pancreas, destroying the cells and creating a lifelong dependence on exogenous insulin. It is among the most common diseases to affect children, second only to asthma, and affects over 1 million people in the U.S. The newly approved drug consists of an antibody that targets a critical protein on T cells, deactivating them and thwarting their destruction of insulin-producing cells. Researchers conducted a randomized, controlled clinical trial involving nearly 80 patients with a genetic predisposition to type 1 diabetes. The majority of patients enrolled were 18 years old or younger. In those receiving the experimental treatment, the median time to clinical diagnosis of type 1 diabetes was delayed about 2 years. Although insulin replacement is an effective treatment for type 1 diabetes, it is not a cure. Despite improvements in care and technology, properly managing the disease remains a challenge that patients face over their lifetime. Moreover, studies suggest that children who are diagnosed with type 1 diabetes before the age of 10 can lose more than 14 years of life expectancy, underscoring the power of novel therapies that can delay or even halt the onset of the disease.